Okay, from that conversation steered by my colleague Dora Manya on the interest of security guards, we now head straight into health matters. And today our topic of discussion is on maternal healthcare. And joining me just to get to talk about this topic of discussion of the day, I am having Everlyne Bowa. Everlyne Bowa is the chair of the Maternal Newborn Health Association, and we also have with us in studio Kenneth Macharia, who is the Regional Director, East and Southern Africa Options Consultancy Services. Welcome to the program.
Thank you.
If we may just begin by with you, rather, Madam Everlyne, when we talk about maternal health care, what are we looking at?
When we talk about maternal health care, and thank you for the question, we are talking about the health of a woman during her pregnancy life, but also after her pregnancy life. Mm-hmm. So that means immediately after conception, that is the maternal health, and also after the conception, yeah. Mm-hmm. Yes.
So that is basically what we are looking at today.
Yeah.
Okay. Now, according to statistics, it shows that the maternal mortality ratio in the country at the moment, correct me if I'm wrong, that there are 355 deaths per 100,000 stillbirths at the moment. Maybe what are some of the top causes of maternal mortality?
Thank you so much, Vivian, and thank you for having me on this show today. Mm-hmm. So as an organization, Options is a global consultancy working in the health sector. Mm-hmm. We have been in Kenya for 22 years. And I think before I answer that question, I think it's important to look at the broader constructs of health and delivery of healthcare, and particularly looking at the various issues that affect healthcare. So issues around leadership and governance is really key to driving this. Service delivery, financing, the health workforce, medical products, vaccines and technologies, and health information systems. So these are really important pillars to the delivery of healthcare. So when we talk about maternal and newborn health, and what are the determinants, what actually is affecting the death, or rather the preventable deaths of mothers as they're having children. We've run a program that's been running for more than 8 years in Kenya. And through that program, we developed a tool called the Maternal and Perinatal Death Surveillance. That tool essentially looks to understand the reasons why a mother has passed on. Right? And what are the real issues that are affecting the mothers that are coming to a facility to deliver. So in Bungoma, for example, through that particular tool, we identified that access to blood when mothers are actually having children was really a real constraint. And so there are various other factors. So access to blood is key. The issues around accessing your antenatal care. And we realize, for example, in Bungoma, the numbers are quite low in terms of just access to antenatal care. So for Bungoma, it's 50%. For Nairobi, we found that it was 66%. Now, why is this important? So accessing a facility and a health provider is really key to determining whether the baby is growing well and whether the health of the mother is actually okay and optimal towards actually having a child. And so this particular tool enables the facility to really dig into the issues that have affected or have caused the death of a mother. And the last piece around the maternal perinatal death surveillance, called MPDSR, is response. And so once you identify the issues, the question is, okay, so what is the action plan? What do you need to do after that? And this is critical. So as I look at the data, it really informs them, and this is where we found out, for example, access to blood. So bleeding was one of the leading causes, but there are other causes as a result. So it helps the facility, the doctors, to really look back and ask themselves, what do we need to do across the entire system to ensure that this mother is kept safe and that she delivers a safe, a healthy baby. But it doesn't stop them. At the facility, that's one area of engagement. At the community level is another area of engagement. So really ensuring that there's a connection to the community. And last year we had the launch of community health promoters in the country, which is critical, making sure that the healthcare in terms of information to these mothers is actually reaching them. The right information and at the right time, and really that they're encouraged to seek health in their nearby facility.
All right, and to you, Everlyne, maybe what is the association doing, that is the Maternal Newborn Health Association, doing to curb this and just to ensure that we bring this number down?
Okay, so for us as an association, we've been keen to engage in different areas. When you talk about MPDSR, it's really keen on the mother and the child. So for us, we are looking at the reports on the MPDSR committee. So number one, we are part of the MPDSR committee at the county and also at the sub-county level, because the MPDSR is a subcommittee that works to look at a facility death, a community death, and then does the analysis to look at what was the gap and what needs to be done, as has been mentioned. So for us, apart from being in those meetings and just discussing and looking at the analysis, we are also keen on looking at what are some of the actions that were made across, and how can we ensure that we facilitate the process. So the key thing that we've been doing is, number one, is participating in the public participation process, the budget process, because the actions are really important to see as, for example, if there's a facility that has a gap, for example, there's no maternity around. So there's a need for the government to prioritize having a fully functional maternity center within the sub-area, which is very important to reduce the maternal death. So that is one. The other thing that we do, we are keen at looking that there's allocation of resources. Just apart from just putting the actions, we need to ensure that resources are allocated on them and then they are utilized effectively. So we, after allocation, for example, in the budget process, for example, they say they want to ensure that you have a blood bank. How can we ensure that there's a resource allocated towards it? So when there's a blood bank, the resource is allocated, we ensure that there's no diversification of funds, because that is also one thing that affects the health sector, because we have resources allocated, but then afterwards we have diversification. So we are keen on ensuring that what is allocated is effectively utilized, and then also the services gotten are increased. So that is one. The other key thing that we are engaging on as an association is to support the facilities to understand what is their role. For example, we have different guidelines. Are the facility informed? Do they need to do refresher courses? So just work with the key practitioners in the health sector to see the gaps, but also look at having the support system within the facility, because we have facilities doing well, we have others that are facing challenges. How can we learn from each other to ensure that we support and reduce the maternal deaths? Because maternal deaths are preventable, but only if we ensure that we do the right thing and also have the support that is needed. And
maybe what are some of the long-term implications on maternal health, you know, to the society at large? One may be wondering, what are the implications?
Right. So one death is too many. And the ripple effect of a mother passing on is huge. It has huge implications. As we know, mothers, our sisters, our mothers are really a core pillar in society. And so the health of our mothers is really critical for the nation. And so making sure that they can access healthcare and that it's of good quality to the extent that they actually get good outcomes as a result of accessing facilities, I think is really, really key. So what are the long-term implications? Obviously, there's an economic aspect as a result of poor healthcare or poor access to healthcare. I know as Kenyans, we all know that we're either called into WhatsApp groups to contribute whenever something happens. And I think that the drive towards ensuring that we have universal health coverage is really, really key to ensure that we also don't have detrimental costs, rather costs that really affect and destroy families as a result of the cost of healthcare. And so really making sure that healthcare is accessible, it's of good quality, and that it's affordable, I think is really, really key. And a healthy nation obviously is going to be a more productive nation. And so those are the implications that we are facing. But more importantly, it's also a question around the values that we place as a country, is that if we are not really taking care of the most vulnerable, then what are we aspiring to? So as a value of our nation, ensuring that we take care of those most vulnerable and women and young girls who are because we have a lot of teenage pregnancies as a result as well. It's important to make sure that those people are able to access quality health care and so that their outcomes are good at the end.
And still in line with that, maybe Everlyne, if you may just hop on to that, why is Kenya's, health for all agenda as important?
So for example, we have heard of the quote that health is really important, but you better consider your health than anything else. So for us, even us here, we are here because we are healthy. And there are people who are in the hospitals because they may be having one challenge or another. So for us is looking at, even let's talk about quality healthcare for all, SDG number 3, is looking at how can we ensure that the maternal deaths are reduced. And we have different indicators, we have different standards that have been set aside to ensure that as a country we work towards them. And one thing that is really important is looking at what are some of the things that as a country we can do to ensure that we meet the standards that are required. And currently, as we are seeing, we are on the conversation of the Social Health Insurance Fund, the shift that is currently transitioning from the NHIF, is looking at how can we improve accessing health quality services. And for me is the gaps, the domestic health financing that we need to focus on. For example, as an individual, can I be able to access health despite where I come from, despite the background that I am in, to ensure that I can get access to wherever it is, because sometimes we go to different areas and there are no, for example, healthcare workers, there are no facilities, operation is not continuing. Currently, we are having a strike. So how is that implicating the health currently in our country?
And we'll come back to that because I have a question on that. But right now, let's take a short break. We'll be back in a bit. Thank you for staying with us. Now, we know that there is a doctor's strike that is ongoing, and actually doctors are expected to take to the streets today. And just to get into this a bit, Everlyne, how does this, implicate, maternal health? What are the implications, rather, direct implications of doctors being on a go-slow or a strike? And, why should this be treated with urgency?
Yeah, thank you. It's so unfortunate that as a country we are in that state. But for me, I would say is let's look at some of the challenges that we've experienced as a country in terms of reducing maternal mortality rates in our country. We've had issues of traditional birth attendance where people give birth in their homes. So we are looking at a state where currently a woman will be afraid of going to the facility because she will not be taken care of. So she would either resort to a traditional birth attendance, and that is number one, relating to maybe unskilled birth deliveries. So maybe it can lead to severe bleeding. It can lead to death. So it, in one or another, it will increase the rates of maternal mortality in our country during this period. Because you see, when a woman is in labor, the first thing that she looks at is going to the facility and getting help. But this is a situation whereby I'm pregnant and I need to deliver. Maybe I'm due, but I cannot go. So I'll resort to other things. But then you see that is not good, because you find so many women will die, that is one. We'll have issues to do with postpartum hemorrhage. We'll do issues to do with unsafe deliveries. We'll have issues to do with people having in a state whereby they do not know where to go. And that means we are getting back to the back days where women will stay and do home deliveries, which is not safe as a country. And that is also one thing that for me, I would like to request that if as a country would look at resolving the conflict, the issues of the current strike, and people to go back to work so that we can have safe and look at, for example, where a woman will be safe to go and deliver in a facility, because that is one important thing also. Yeah.
And now that you've brought that up, you know, the matter to do with traditional way of giving back, you know, how it used to be done back then when women just used to give birth in their homes. Maybe what are some cultural beliefs and societal norms that are impacting maternal health to date?
So for me is looking at, for example, you see when a woman is in labor, and maybe, for example, maybe due to complications, he's supposed to go and deliver, but then with the doctor's requirements, maybe he needs to, for example, go through a CS. But then you see there's issues to do with consent from the partner. And that is looking at, for example, if the partner is not in a position to agree, because people also have cultural beliefs about the CSs. So that means that woman, her life is in danger. But also the other thing is we have people who believe that as a child, they was brought up. Because for me, I've worked in our community, and we have a woman who've done 6 deliveries at home. And for us, looking at, this is what I've been doing, why should I go to a facility? But then you see, it needs a lot of sensitization and awareness for women to understand that however we are looking at our cultural beliefs, we need to look at what are the important ways that would help us access self-delivery. Because look at, for example, when maybe the child has a complication and needs to be supported through a life machine, will that happen? That means that child will be lost. And currently we're not talking about maternal mortality rate that is high. We are talking about neonatal rates. That means children are more dying than their mothers. So then also there's also needs to be a shift in terms of how we are addressing the current issues of maternal mortality rates. Yeah.
And maybe to you, sir, what role do community health workers play? What role should they play in promoting maternal health care?
So community health promoters, because now they're called community health promoters.
Or not community health workers.
Yes, are critical in terms of ensuring that services reach the most vulnerable, the people who are farthest to reach in terms of away from the facilities. So it's critical that they're there. They are normally trusted members of society who understand the society that they're in, so they're placed in places where they actually live. And so they really understand the context of the issues that are actually affecting mothers. As Everlyne has mentioned, you know, the cultural issues that come to play. And so their understanding and them being involved in that context of the community, they are better placed in terms of providing information, really being able to provide that information that is relevant, that is reliable information. But more importantly, it's looking at it from a systems perspective. So at the community level, it's good to do the preventative work, but then it's important to also have the referral pathways to ensure that that mother who's in the community can actually go to a facility. So the linkage and the relationship between the community health promoters and the healthcare system is really, really key, because those referrals are very important in terms of being able to say, hey, you need to go and see a doctor, and that the facility understands that there's someone coming to see, for them to see, and these are the issues that they're facing. As it is, you know, access to more than 4 A and C visits is a real challenge in the country. And so even in terms of, just going to add on to what Everlyne has said, is that, you know, delivery is one thing, right? Preventable deaths of under 5 is also really critical. So what is the health of the child once a child is born? And what happens at the community level? And do they continue to have a relationship with the facility to be able to go back and actually receive the care? And we're talking about issues, for example, around nutrition. Is a mother healthy? Is she being advised on nutrition? In terms of also nutrition for the baby, issues around breastfeeding and availability of feed for the child. And so that is also really critical. So that sort of advice, those are things that community health promoters would do as a continuation of care from the facility, but also thinking about more broadly, thinking around issues around vaccines. Are the children receiving the right vaccines all the way to year 5? And so ensuring that continuity of care is there, and that community and the health system are working jointly, I think that is so important. Yeah.
Yeah, and I acknowledge what is being said, and you see the current government has ensured that they support the community health promoters, and it's important to capacity build the health promoters, to understand their key role, and also to look at how can they do an holistic approach, apart from just ensuring that a woman goes and delivers in a facility. What about working through with this woman to ensure that we reduce the neonatal deaths, the under 5, yeah? If you support this woman to understand what are some of the do's and don'ts after deliveries, how can you take care of your child, so that they now can be in a position also to support that woman even after delivery. It's not just a matter of doing a PNC visit, yeah? It's also looking at, is your child healthy? How are you taking care of yourself? What about the child?
Yeah.
And we have the health promoters attached to different facilities, looking at how they can support a particular community where they serve, and also look at how to ensure that the facility works very well. So I know the government did very well in terms of increasing their stipend, which really did a motivation to them, also to support them in doing the work, because doing community work is not easy. And as a level 1, they are the people who are in direct contact with the woman and the child in the community. So it is them who would also play a key role in terms of reducing the maternal mortality rates. So I see it's important also to focus on the level 1s, the community health promoters, in seeing the reducing of the maternal mortality rate and also the neonatal deaths, by capacity building them, but also looking at how can we support them in terms of skills. Yeah, thank you.
Are there any policies maybe that have been put in place to ensure that, you know, maternal health care is being guarded? Yeah.
Yeah, we have policies in place that are currently in store, and one key gap in the policy is looking the community health promoters. Do they have a policy that they are following? How can we now start doing that conversation of the policy on community health promoters? Yeah, because we have the general health policy that has the different guidelines in terms of the different levels and the roles that they play. And now the community health promoters are now the level 1 who are indirect. So I think there's need to have that specific policy in place. Yeah.
And maybe to you, sir, maybe why is it important for counties to just increase, you know, domestic resource mobilization?
That's a very good question. We all know that finances are, we don't have enough resources, and that's a fact. The question is, how are we utilizing the resources that we actually have? How are we prioritizing those resources? So part of what we've been doing with this particular program, it's called the Evidence for Action program, is really looking at data and gathering data and really understanding what are those determinants of health in a particular setting. As you know, health is local. Right, it really is at your point of access, right? Your context will be very different. You know, accessing healthcare in Meru is very different to accessing healthcare in Wajir. So making sure you understand that context is really, really key. Their needs will be very different. So we've been working with county governments to really look at what is the data telling us, yeah, in terms of what are the real issues affecting the health of mothers, and then looking at working towards building business cases with the counties towards allocation and prioritizing resources to the right places. For example, in Bungoma County, through this MPDSR report that we undertook, we were able to identify that blood was an issue. Right, and that bleeding was one of the leading causes of mothers' deaths, right, in the county. So we basically advocated and worked with the government of Bungoma, the county government of Bungoma, to really look at how do we have a costed plan that looks at the issues of blood. And I'm happy to say that they've actually invested in a blood bank in Bungoma. Before that, they had to send their blood for screening to a different county, which took a long time. Obviously, we've seen a huge change in terms of how blood is being handled in the country. So I think that's a real progress and real pat on the back for the government to actually doing that and ensuring that they're opening up more satellites where blood can actually be tested, which then reduces the turnaround time between the collection of the blood, but also the screening, but also bringing it back to the facility for use. So I think that's a really good example. But also, I think there are broader issues that we need to address. For example, our behaviors in terms of health-seeking behaviors. How do we influence the way people seek behavior? I think the whole focus around primary healthcare is so important that it starts with you. Right, and making sure that you are aware of what is actually affecting your health, whether it's the things you do, whether it's alcohol, you know, those sort of things, whether it's the foods that you eat, you know. So I think it starts there, and it starts with the information, right? And so that is really, really key when we're thinking about the broader issue around healthcare access. Yeah. Now, counties, there are bills that have been passed at the national level. There's a bill that was passed called the Facility Improvement Financing Act of 2023, and this was really to provide an overarching framework that then counties could adopt, right, to actually pass their facility improvement fund bills in the county assembly. Now, what does that mean? It means that any resources that are generated at a facility level are then retained at that facility level, and it's really, really important that most of the counties adopt that, because there's then a very clear incentive that the more services you deliver, the more you're able to claim. Right? And as a result, those resources come back to you, and then you can reinvest and deliver more services. Now, what's key there is that there are two aspects. One, you have to ensure that your facility is well equipped, it has the right staffing, you have the commodities, so that the people that you're serving in a particular catchment area actually see your facility as a place to go, right? At the moment, you'd find that there are situations where there are some facilities that may not necessarily have the full provision of healthcare. As a result, the clients, mothers in this case, would bypass those facilities and go to a facility that they think would be, you know, or maybe it's a facility that they've used before, where they can actually access healthcare. So we're trying to reduce that, and I think some of the incentives, not incentives, but some of the programs that have been set out are really looking at, for example, primary care networks to really build the need a hub and spoke model where, you know, healthcare is closer to those who need it, and if there's a complication, there's a place where you can actually refer, and that there would be the necessary resources at that particular place to offer the care. So I think domestic resource mobilization is key. That retention of resources at a facility level is really, really key. I think the planning and budgeting process is also extremely important. So use of data to inform why you should invest in certain areas, right? Because the data will tell you about your community, what is actually happening in your county, for example. It will basically tell you maybe there are places where, you know, cancer is more prevalent than other places. So what do you do about that? Yeah. So the use of data is really important so that you can then allocate the scarce resources to where it is needed most. And I believe what Everlyne has been doing, and we've been supporting the association that Everlyne is running, is really towards ensuring that at the community, there's that connection to the community. And the work they do is really ensuring that the voice of those in the community is heard, right, in a constructive way, because I think it's really important to have constructive conversations in a way that you're using data to actually drive the conversation. And that way you find the solutions that are more, you know, that everybody is agreeable with, because it's all set out on data. Yeah.
You've mentioned that you are working towards ensuring that everyone receives quality, you know, when it comes to healthcare. So that means that as it is right now, we don't have enough facilities, quality facilities, as it is, as we speak, you know, in the country.
So let me say this. quality is a moving target, right? In the sense that it's an ongoing process, right? Today, there'll be one area that, for example, the MPDSR report will highlight the issues of blood. So the response side is to say, okay, fine, then what do we need to do around access to blood, right? It may also highlight the need for A&C visits. So what then do we need to do? So at a community level, at a facility level, then the leaders there would need to look at, okay, where do we need to put our resources to ensure that the quality that we're delivering is consistent? Because today, quality today, and tomorrow you have poor quality, you know, it doesn't really help anybody. So it's making sure that the access to quality is consistent throughout. So making sure you have the right steps, the right systems in place, and really having that ongoing process of learning. So that's why I think it's a moving target, that you're constantly working towards it. So you can't, it's not just it's not an activity that you do. It's an ongoing process that you have to be fully invested in.
Yeah, and I would like to give an example. For example, see, for me, I use NHIF to access health services in Bagathi Hospital. So for me, I'm looking at how is the capitation, the amount that I'm paying, supporting the facility to grow, for example, in meeting some of the challenges that they're meeting. We had, in our meetings on NHIF, we did a capacity building to ensure that there's increased claiming for the facilities to support them in what they're doing. So looking at, for example, a facility has a challenge, for example, in looking at how can we support the women who are coming in accessing, for example, services. And the facility, for example, currently they are doing a porridge for every woman who comes for a clinic. And you see that is the capitation amount that they are using to support the women in the facility, but also looking at improving their service delivery. That is just one. Looking at how can we support the public health facilities access their NHIF claims, because there's a gap between the private facilities and the public facilities. So if NHIF and Ministry of Health can really work together to ensure that public facilities can easily access their claims, because there's a lot of backlog in terms of the claiming and the capitation. Only a few facilities can access their capitation fee. And you see, when they access their capitation fee, they're in a position to identify gaps, but also meet those gaps within the facilities. They do not need external resources. That's what we're talking about, domestic funding. The amount that I'm giving out is also supporting the facility to increase service delivery within that facility. So that is one key thing that if we focus on as a country, health will be really good for everyone, because if I can be able to contribute to my NHIF and be active and access a service, and the first service that I'm accessing, I go to that facility, there's this gap, but I'm happy to hear that due to the gap that was there, my money supported the facility to meet that gap. You see, that is something that as a country, let's focus on that, and also look at, for example, how can we ensure that there's a slope, a fast process in terms of claiming. Because, for example, in a facility like Bagathi, I believe they see a lot of patients in terms of who are using NHIF. How are they able to, for example, access that amount of money as fast as possible to support them in reducing some of the challenges that they are facing?
And even as we talk about that, maybe what's the importance of postnatal care? You know, we're looking at the maternal health care, you know, before, you know, prenatal, now posts. What are we doing about that?
So when you talk about postnatal care, generally it's about the access to services and also care of a woman after delivery. Not just a woman, but also a child.
The baby as well.
And that is why we are having a gap in that area, because we have increased neonatal deaths, So it's important to look at the support of a woman after delivery, because many of the times I've sat in a committee, where in an MPDSR committee, and they're discussing a mother who lost her life after delivery, and in the MPDSR report, it was just lack of information. The woman did not know what to do after. So I think it's important also for facilities to take in very keenly on how to inform a woman after delivery. So not just after delivery, you are free to go home. Have a conversation with that woman and just tell her, this is what you need to do after delivery, 1, 2, 3. check on 1, 2, 3, so that it also look at, the woman would know, okay, then this is what I need to know. So if we also do capacity building and awareness to every woman in terms of postnatal care, it will also support in reducing the deaths, that is one. But also, let us look at how can we support the CHPs to support these women in the community, to be able to improve the postnatal care. Yeah.
And could I just add on to that? Because I think there's two key issues that also need to be addressed. So for example, there's postpartum hemorrhage that happens, and it's a leading cause of death for mothers. And so being able to have the right protocols in place to support mothers after they have their child, I think is really, really key. The other thing that we haven't necessarily mentioned here today is really about postpartum depression.
Oh yeah.
Right? And so that's a real issue, and the issues around mental health and the support for mothers post actually having their child is actually really, really key. So as we think about the provision of care for mothers, we need to think about it from a holistic perspective, as you say, the pre and the post, right? Is to make sure that she's in a position where she can actually take care of the child well. And so she needs to be well so as to take care of the child.
Absolutely. You know, you can never pour from an empty cup, they say. How can we leverage technology, you know, to improve in these services? And are we already doing it?
I would say yes, because I follow the Ministry of Health quite on a daily basis, and just looking at how they do their capacity awareness in terms of different importance on everything. So for me, it's looking at using the currently media stations, even the local radio stations, to do the capacity awareness and look at meeting everyone. Because not everyone would access the social media, but also looking at doing advertisements, doing short video, short clips that would support access to information. Because the most important thing here is access to quality information, and also looking at what is the easily access mode of information to my target audience. Because if you know your target audience, it will be easy to identify what you need to do to support them. So yes, there's been ongoing that, but there's need to do more. Yeah.
I think I'll add on to that. I think the use of technology is critical, even at this day and age. So really glad to hear that the government is thinking about digitizing health records. And why is that important? So that if I access care in Kisumu for the first time, I can continue my care in Mombasa without there being a drop in terms of understanding my issues, understanding the sort of care that I'm going through. So digitizing patient records will really be transformative. And the use of AI to really analyze the data and really tell us what is the status of the health of the nation, and making sure that that information is made available to those that are delivering healthcare. I think so that's number one. I think the issue around dashboards for management, especially at a facility level, so that they have real-time data that tells them what exactly is happening in terms of the delivery of care at their facilities, so that they have timely interventions, right? Because if you think about it, right, if MPDSR report is produced and they're supposed to constantly meet, it's very manual at the moment. So digitizing that process would be fantastic, right, in terms of telling the facility managers, this is what's actually happening and this is what we need to do, so that the data is real time and it informs both in terms of resource allocation, but also the actions that they need to be taking.
I really appreciate that you took your time to come grace our studios today and just to get into this topic, that is maternal health. So thank you so much, Everlyne, Bowa and Kenneth Macharia, for coming to our show today.
Thank you for having us.
All right, this is where we end Good Morning Kenya for today. Do enjoy the rest of your viewing.